This is called the stretch circle, and so each of us is going to just lead. The stretch circle actually dates back about 5 years ago for me. It comes from improv, and it's one of the exercises that is done to be able to mirror each other, to be able to focus on each other's body language, and also multitask by describing really what you're hoping to get out of the case, and also what you might have learned from the previous case. So what we do is we leave the room, and then the surgical team circles up. We're usually arm's length from each other, and then each one of us will lead a stretch and describe one objective that we're hoping to achieve during the case. While I'm describing that, each of them is going to mimic me exactly, so that when it comes to them, then they have to pick a different stretch. So we know that surgery is an occupational hazard, and we're realizing now that surgeons and surgical staff and so on get injured just like any other occupational hazard, whether it's standing in one position for really long periods of time, or holding your arms, your neck, or standing on one leg as opposed to both legs, or leaning in instead of keeping straight postures. We're learning an awful lot about the ergonomics and strain associated with surgery. The stretch circle is just a great way to just warm those muscles up beforehand and just be cognizant of your own physicality prior to entering the operating room, so that we can do the best thing we can for patients. We've been doing it now for 5 years. It's an opportunity for self-reflection, for sharing the mental model about surgery, and also understanding each of the individual team members and their objectives, and helping to achieve those objectives in a very non-hierarchical, safe place. So I do really think that the stretch circle is an important activity before surgery, and not just for gynecology, not just here at Northwestern Medicine, but really for every specialty in every hospital. And so we took the extra step of publishing this in academic medicine, and I'm hoping that this will be adopted to improve outcomes everywhere. My focus professionally in a research setting has been outcomes, reducing complications, education, association with volume. And I realized that these little things that we do that seem kind of really not that important turn out to be really important. And while the stretch circle may not sound like a big thing, gosh, you're stretching and talking about the surgery beforehand, it actually turns out to be one of those like big things. I just find that everybody on the team, whether it's the nurses or the surgical tech or the student, the resident, the fellow, everybody benefits, and most importantly, the patients benefit.